Right, welcome everyone to the latest Queen Elizabeth Scholarship webinar hosted by the McMaster Health Forum. We're coming to you today from the McMaster Health Forum in the Mills Library at McMaster University. Today we have a special treat. We have two presenters who both went on an internship together to CARPHA in Trinidad and Tobago, and Stephen and Cameron will be presenting their work together, talking about some evidence-informed decision-making networks in the Caribbean that they dealt with. I'll give you a quick little summary of the McMaster Health Forum. It's a leading hub for improving health outcomes through collective problem solving. We aim to harness information, convene stakeholders, and prepare action-oriented leaders to be agents of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is run by a partnership between the Rita Hall Foundation, Community Foundations of Canada, Universities Canada, and Canadian universities. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The Queen Elizabeth Scholarship here at the Forum is called Strengthening Health Systems. Our scholars will contribute to strengthening health systems and become part of our large and growing network of health system leaders. We've had two cohorts of scholars so far. This is our first cohort of scholars who went away primarily in the calendar year of 2016. And this is our second cohort of scholars who primarily went away in this year, 2017, of which Cameron and Stephen are part. One of our presenters today is Stephen. Stephen, at the time of his internship, was a BHSC undergraduate student here at McMaster. He developed an interest in using evidence to implement health system policies that can improve youth health from his experience directly working with adolescents. His additional interests include epigenetics, health economics, and pediatric clinical research. He is currently an MD student at the University of Toronto's Faculty of Medicine. Our co-presenter today is Cameron, who was also a BHSC undergraduate student at McMaster at the time of his internship. He developed an interest in the social determinants of health after conducting research on how patient perspectives of their healthcare differences differ according to gender. He did this working with faculty from the Harvard T.H. Chan School of Public Health. Cameron is also currently an MD student at the University of Toronto's Faculty of Medicine. So I will turn it over to you, Stephen and Cameron.
Thanks so much, James, for the warm welcome, and we're both really excited to be here. So just to start off, my name's Cameron, as James mentioned, and today we're going to be presenting a little bit about the Evidence Portal, which is the evidence-informed decision-making network of the Caribbean. And this includes a variety of initiatives that we're going to be getting into, and particularly we're going to be speaking about a case study in applying a logical theory of change to strengthen research uptake in policy development.
Okay, so hi everyone. So this will be the agenda that we'll be going through today. So we'll be talking about the aim of research that we conducted in Trinidad and Tobago, and talk about the problem that we witnessed there, which is the research policy gap, and talk more about the theory of change and its application. We're going to be talking more about the model and its components and considerations moving forward. And we're going to be ending our presentation by sharing with you our experiences in the Caribbean region and what we took away from it.
So the aim of our research was really trifold, and we had three primary objectives. The first one of which was to describe a theory of change for bridging the research policy gap, specifically in the Caribbean. Two, to describe the evidence-informed decision-making network of the Caribbean, long for evidence, as a case of this model. And then finally, we wanted to identify indicators for future evaluation and assessment of this model and similar strategies. So we've thrown in a couple complicated words there, but we're going to get into these very shortly.
Okay, so in the Caribbean region, we realized that there was this massive research policy gap. And we got to understand that this is problematic because in the last 2 decades, the really importance of evidence-informed decision-making process has been prioritized on a global scale. Now, in fact, this need for evidence-informed guidance and policies can have a profound impact on health systems' performance, and it was actually one of the 6 priorities that the Director General of the World Health Organization at the time emphasized. In fact, in 2011, the WHO actively urged all member states to incorporate evidence-based approaches to develop health policies, because we all know that evidence-informed policy can effectively bridge the gap between what's out there, what is the best available evidence in the literature and how to best move forward in terms of policy making. It really has the ability to address health systems issues in a systematic way, not based on some anecdotal information, but systematic with robust information that can allow policymakers to formulate effective options for interventions. Now, we understand the importance and how WHO has been trying to urge all members to do so, but in reality, the actual practice of evidence-informed decision-making is still lacking in certain areas of the world. Now, many policymakers may continue to formulate policy without actually consulting the best available evidence out there and turn to other sources for their decision-making processes. And also, policymakers are less likely to trust knowledge that does not align with their values. And this was a phenomenon that we've noticed in Trinidad and Tobago and other Caribbean countries.
Okay, so thanks for that, Stephen. Before we go into addressing this research policy gap that's so important in the Caribbean region, I'm going to talk a little bit about what exactly theory of change, or TOC, is. So TOC can be thought of as a tool among many that can be used to either design or evaluate social change initiatives. These can be projects, programs, or even policies. One way of looking at it is a blueprint of the building blocks, so all the little components that are needed to achieve the long-term goals, and then subsequently communicate in a visual fashion why a particular initiative is likely to succeed or even why not to succeed. Okay, so there are about 6 components or building blocks, as I like to say, to the theory of change model. So first you have to identify long-term goals, impacts, outcomes, things that you're trying to achieve. And afterwards, once you have these, you need to go backwards, and via backwards mapping, you have to connect preconditions or requirements that are necessary to achieve these goals. Now, as you're doing this, there needs to be some identification of the basic assumptions, because at each stage there's inevitably going to be assumptions that are going to be made. You need to also identify the specific interventions that are going to be used to create desired change. You need to develop indicators to measure the outcomes and to assess the performance of an initiative, because otherwise, how will you know if it's adequately addressing your needs? And then finally, and I think this is the most important part of the whole model, is writing a narrative. So essentially writing a story that puts all these components together and helps clearly illustrate why the initiative is likely to succeed. So you're probably wondering now, why did we specifically choose to use this theory of change model in addressing the research policy gap? Well, one of the main reasons is that this gap, similar to many social change issues, has a lot of different variables and factors that are involved in it. And as a result, these factors often intertwine, they interrelate, and there is not a single direct cause and effect relationship. It's many things that are contributing to it. So the theory of change as a map, it kind of looks like a spider web, sort of, and it shows these relationships especially well. It can be used to help identify the elements or the building blocks in this initiative that are critical to its success. So then you can know what's exactly the key that's causing this initiative to work, and then can we take the same component and maybe apply it to something else. And finally, and I think this is especially important, is that it can help us build a common understanding and expectation, especially among the different stakeholders. So in initiatives like this, there's often researchers, there's policymakers, there's the public, and all of these people have different perspectives. And the theory of change diagram really helps communicate an initiative clearly to all stakeholders and parties involved. So as you can see here, this is our completed theory of change diagram. We have problems at the top, followed by inputs, activities, outputs, outcomes, impact, and finally the long-term goal that we're trying to achieve. So now in the remaining part of the presentation, we're going to go through each section of this diagram and help you understand why and how we addressed these problems.
Okay, so starting from the top of our TOC model diagram, we see that we have the problem. So as we mentioned, the problem is the gap between research and policymaking processes, and I'll be just going through some of the different components that we have observed within this particular problem. Okay, so if I can draw your attention to the very left in the red box, we see that as one of the components of the problem, the access to research in the region is not systematic or widespread. And in fact, the dissemination of research evidence has been shown to be less than optimal. And in fact, we were able to really identify this through looking at a case study that has been done with the Jamaican experience. Now, policymakers there have reported poor access to published literature and the minimal capacity for knowledge translation and dissemination. And in fact, these factors were determined to be among the most significant factors contributing to the research policy gap. Now, the literature suggests that resources such as one-stop shops, which is very similar to McMaster Health Forum's Health System Evidence or the Caribbean's Evidence Portal, have been suggested to be the key factors to ensuring policymakers to have timely access to research evidence. Okay, so moving on to the next section, we've also realized that the type of research evidence needed to inform health decision making was not the type that was being conducted. So what this means is we know that in the pyramid, in terms of the hierarchy of the strength of the evidence, we know that systematic review and meta-analyses are way up there. And usually these studies are the ones that can help policymakers when it comes to policymaking. Unfortunately, we don't really see that being conducted often. We see low-grade quality studies, so that was problematic. And we've also noticed that there were a few provisions within national planning and policymaking processes for systematic review of research evidence. So in short, relevant, systematically reviewed evidence is significantly lacking. And according to our lit search, we realized that according to a survey that looked at low and middle income countries, such as that of the Caribbean region, they've reported the lack of, sorry, it's just a little laggy for me. Sorry, yeah. So the research of low and middle income countries reported that less than half provided systematic reviews of research literature to their target audiences. And these factors are also compounded by additional barriers, including the inapplicability of research to local climate and context. So what that means is, let's say that you've managed to find some systematic reviews of information, but it won't really work because it's not suitable for the local political context and the social context there. So it's really not applicable. If we move along to the next section, we also noticed that there was this very little interaction between researchers and policymakers. Now, this disconnect, when we investigated a bit more, we found that this disconnect can be explained by their differences between the two parties in terms of their goals, attitudes, perceptions, and beliefs about a given health system problem. Now, policymakers might perceive very little incentive to interacting with researchers who they regard as elitist, and researchers may fear sacrificing their independence during research. We also found that policymakers may, in fact, rank research evidence low on the hierarchy of factors that are deemed important for decision making. And finally, we've noticed that policymakers in the region may lack the expertise to use research evidence in decision making. So what I mean by this lack of expertise? Well, this has been elucidated in several research findings, and this includes insufficient statistical and evaluation skills that can really allow policymakers' ability to plan and utilize research evidence. Also, many policymakers may have varying understanding of some of the most crucial skills, including economic analyses, equity, and the notion of burden of disease measures. and they may be very vague in terms of their use in national decisions. So improving the technical capacity of policymakers is believed to facilitate the research uptake in policymaking processes.
Okay, so now that Stephen's gone through the main problems that are in the Caribbean region, we're going to walk you through the inputs followed by the activities and the outputs that are necessary to achieve the impacts and the goals. So inputs are really like substrates, things that you put in. Activities are actions, and the outputs are the direct result of these actions. So to address the problems such as access to research evidence that is not systematic or widespread, and the less than optimal dissemination of research evidence, we need a couple of inputs. So the first one, and you'll notice this very consistently among many of these categories, is human and financial resources. So everything pretty much requires this. Next, we require the Virtual Health Library and MedCarib. Now, these are databases that are commonly used in the Caribbean, where you can find research articles and studies. So once we have these resources and these inputs, we do harvesting and warehousing of research evidence, and this results in the evidence portal. And the evidence portal, which we mentioned earlier, is very similar to McMaster's Health Forum's Health Systems Evidence, where it is a one-stop shop. Okay, so the next input that we're going to be looking at, the next problem that we're going to be addressing is the incorrect type of research being conducted and few provisions within the national planning and policy-making processes for the systematic review of evidence. To address this, once again, we need human and financial resources, and we need evidence portal, we need health systems evidence, we need health evidence, and PubMed. So one thing that's really interesting here is notice how one of the outputs from the previous set that I showed you is in fact an input here. So evidence portal was an output. Now we're using that as an input to address this next problem. And that's why the theory of change diagram is so helpful, because you can see how interconnected and interrelated everything really is. So once we have these inputs, we do searching, we do appraising and synthesizing of evidence. As well, we can conduct key informant interviews. And this is what produces an evidence brief. Okay, so next, we wanted to address the problem of little interaction between researchers and policymakers. Again, we need human and financial resources. We need a planning team, a steering committee, and an evidence brief. Now, all these inputs put together, along with project planning and management, as well as facilitating stakeholder dialogues, will give us a few key outputs, namely a dialogue summary, a topic overview, and a commitment to act form. Now, if you shift your attention a little bit to the right, you can also see that another indirect output of this is a functional community of practice. And I'll get into this a little bit more in just a few seconds. So to address the problems that research evidence is low on the hierarchy of factors that is deemed important for decision making, that little interaction exists between researchers and policymakers, and that policymakers lack the expertise to use research evidence in decision making, we need human and financial resources, policy and planning technocrats. Once we have all these inputs and resources, we move on to activities, which include the sharing of knowledge and discussion, as well as supporting peers. And this similarly results in a functional community of practice. And a functional community of practice is really a supportive environment where different stakeholders can come together and they can discuss their anticipated changes, and they can work together and stay motivated to do the things that they are committed to do. Okay, and last but not least, we wanted to address the issue that we need to improve the current lack of expertise in using research evidence in decision making. So often in the Caribbean, we noticed that we went to one consultation, for example, where they were teaching different stakeholders from across the Caribbean region, from like a bunch of different countries, how to use a specific statistical analysis software. Now, this isn't the common problem that I guess you'd encounter here in Canada, but over there, this was a problem, and they had a very unique way of addressing it, where they would bring people from all over together. They would have a couple nights of conference and really work through these problems together, make sure everyone's on the same page, and then these people would go off into their own nations and subsequently train people there. So to do all this, we need resources like human and financial resources. We need experts, a trainer. So in our case, the trainer was a facilitator from CARPHA, which is the Caribbean Public Health Agency where we were interning. We need trainees, so these are the people from all the different Caribbean nations coming together. And we need some sort of training materials and computer programs, whatever is required to do the activities. Once you have all this, you can actually carry out the workshop, and the end output, the direct output of this is trained policymakers. And as you'll see in a few slides, like Stephen will get into the assumptions of this model, and this is a very good place to discuss assumptions because, for instance, when we say that the output is trained policymakers, we're assuming that the people at the workshop are motivated and ready to learn. And if they're not, then the result will not be trained policymakers. So we'll get into that a little bit later. Okay, so we've now discussed problems. We've gone into inputs, activities, and outputs. Outcomes now are when you combine several outputs, and you look a little bit bigger picture. So what are these outputs trying to lead to? And in our case here, we have the increased availability of relevant evidence when needed, and the keyword there is relevant, and when needed. Because if it's not relevant, or if it's there but takes a while to get, or it's difficult to access, then it's not going to be worthwhile. The next outcome that we have is policymakers and stakeholders are better equipped to initiate and advocate for evidence-informed change actions. Remember, this had to do with the function of community of practice, had to do with the evidence briefs and stakeholder dialogues and all this discussion. And lastly, we have the increased ability to find and use evidence. And this was related to training policymakers. Okay, now this last one, the last part of the diagram, is about impacts and goal. And these are even broader level, more bird's eye view than the outcomes. And the problem we were trying to address was the increased use of the best evidence in decision making. And after that, we want to see health system changes that address challenges. And finally, as with any public health initiative or intervention, I think the main goal is to improve the health and the well-being of the population. And that's what we hope to achieve here as well.
Okay, so as Cameron was going through the model, he identified a couple of outcomes, and we actually came up with several indicators to see if our model was efficiently working. So in terms of our outcome, the increased availability of research evidence when needed, we've identified that the percentage of survey respondents from the Caribbean Public Health Agency's internal mailing lists who report that there is sufficient available research evidence can be a good indicator, along with the percent change in the number of monthly users who visit the evidence portal. Now, with respect to the outcome better equipped to advocate and initiate for evidence-informed change actions, we believe that the percentage of survey respondents who implement or advocate for the decisions from a dialogue they participated in will be an excellent indicator. Okay, we also have our outcome increased ability to find and use research evidence, and this will be assessed with the indicator the percentage of survey respondents who report that they feel competent in using research evidence for policymaking. And the overall impact of our TOC model, which was the increased use of best evidence in decision making, will be assessed with the indicator percentage of Caribbean health policies and programs that are informed by research evidence. Okay, so I believe Cameron briefly touched upon some of the assumptions that we had to make when we were constructing the TOC model, and I'll just be going through some of the other assumptions. So now with respect to the evidence portal, we assumed that the search function, the automatic search function of the portal interface was fully able to capture all relevant documents. Now, for the evidence brief itself, we made the assumption that there are existing available systematic reviews. And for the dialogue summaries, we made an assumption that there are actually sufficient human resources and internal capacities to facilitate the events, followed with the willingness of key stakeholders to participate. Now, this is an assumption because, key stakeholders might not be willing to do so. Also, we made the assumption that participants of the dialogue actually found value in the process, which Cameron talked about, and would be willing to use the evidence findings that were presented in their practice. Okay, so in conclusion, we had the chance to talk to you guys about the evidence-informed decision-making network of the Caribbean, the evidence, as a case of a theory of change model, and identify several indicators for future evaluation and assessment.
So it's really our hope that, with all these endeavors, we can really address these problems in the Caribbean and achieve a solution that's going to bridge the research policy gap. We realize that this isn't something that's going to happen overnight, but with all these changes and all these indicators for assessment, we hope that over the next few years, maybe even longer, that we do see some noticeable change in research uptake.
Okay, so we also want to talk to you guys about some other work that we've done in Trinidad and Tobago. Now, we have to understand that we actually went to a very special place. This was a public health agency, and they actually do more than just policy work. They do a lot of other works, and we had the chance to attend several workshops and consultations that we kind of talked about in our TOC model, just assisting our PI there. Through that process, we assisted with specifically the evaluation data entry and analyses.
Yeah, so one of the most valuable parts for me, I think, was seeing just the broad array of work that's done in the public health agency. And as Stephen mentioned, not a lot of scholars have this opportunity to go to a public health agency. A lot of them went to very academic institutions, such as the university, but we went to a public health agency. And here we got to learn about the needs specific to the region. So as I'm sure you're aware of, the Caribbean region, it has mosquito problems, and a big component of the public health agency is surveillance of mosquitoes and mosquito-borne diseases. So we had a really cool opportunity to go around the compound and collect samples of mosquito eggs, then go take them back to the lab, grow them, and then do resistance testing on these mosquitoes to see if they were being resistant to the pesticides and the drugs that were being used to keep their levels at minimal levels.
So we just want to share about our overall internship experience. Now, we have to understand that this QES program isn't just for academic growth. It's actually a huge cultural growth. So Cameron and I went in there not really knowing what to expect. And we really had the chance to learn about the unique culture, whether it's food, whether it's the traditions, just everything. It was new to us, and we believe that this was a tremendous personal and cultural growth at the end. And like we mentioned, just by being able to participate in this whole array of events and activities, we had the privilege of learning about the role of a public health agency, especially within that region.
And I think the most rewarding part for me of being in this region was just being so surprised by the type of people there. Everyone was so welcoming, so warm from the minute we got there, and we got to really form a lot of close bonds with the other staff members there, with the researchers there. There were a few other interns that were local, and they were able to show us some of the region, and it's just the culture shock was different, but it was a really great culture shock to be a part of. And I think looking back at our initial hesitations for going into a region such as Trinidad, they were quite unfounded.
We also want to touch upon, so we were able to also learn about the set of health issues pertaining to the Caribbean region. Now, in Canada, we don't really consider diabetes and obesity to be, although it's important and it's definitely prevalent, it's not to the same degree as the Trinidadians are facing in the region. So this allowed us to really appreciate that in different contexts, in different social, political, and cultural contexts, you have different set of challenges that need to be surmounted. Also there, we realize that mosquito-borne diseases are just huge. That's something that we as Canadians don't really consider on an everyday basis, but there is a big issue. So it's really perspective changing, and we really had to kind of shift our perspective and way of thinking to effectively help them address those issues. Okay, so this comes to the end of our presentation. If you guys have any questions, we would love to answer them. Thank you so much.
Thank you.
All right, wonderful. Thank you very much, Cameron and Stephen. That was very interesting. We'll open up the room and those online for questions in a second. I'll ask the first question and to get the ball rolling, and then I'll ask the room. So the CARPHA is a unique organization in that they're not one government. They actually deal with lots of different governments throughout the Caribbean region, and all for a common goal. But as you know, different places have different ways of doing things and different opinions. So I'm curious from the two of you what your perspectives were on some of the challenges that an organization like CARPHA can face when they're dealing with multiple systems within one common goal.
Okay, so with respect to, so I think, James, you mentioned a good point. It's such an intergovernmental organization, and every day we would see like high-profile stakeholders from another Caribbean country. I think one of the challenge might be is that it's really hard to coordinate all those stakeholders. So every time they have like consultation or some sort of events to train people, it requires a great deal of coordination. People need to fly in from different countries and all convene at the Port of Spain, Trinidad and Tobago. Now, I think that problem is somewhat alleviated because there are other branches of public health. So they have a branch in, I think, St. Lucia and St. Martin's, I believe. So while that's there, it's still a problem if they want to hold a major event for policymaking and learning about the research techniques. They actually have to invite all those stakeholders. So that might be one of the challenges that they may be facing.
In addition, I do agree with you, Stephen, but I think there's also a large scarcity in human and financial resources there. So, for instance, we had an opportunity to meet like a broad array of people from CARPHA. Like we were working directly with the policy person there. But for instance, she was the only person in her department. So like there's a policy department, but there's only one person in it. Or there's like a statistics department, but there's only one person in it. So the workload that these individuals have and the pressures that they have to produce work is often huge. And that comes off with a lot of stress and a lot of difficulty, a big burden on their shoulders. In addition, there's a lot of restrictions on the content they're able to get. Like we're from McMaster and University of Toronto, so you just go online and you have access to almost unlimited amount of journals, but it's not often the case there where they have so much access to information. So I think those are a few of the challenges that they would be encountering.
Yeah, just building off of that, the scarce resources and the content, we were surprised because it was really hard to find relevant information from the region. Due to the lack of resources, they don't really have access to these high quality journals that, a lot of McMaster and Canadian university students would have. And also a lot of those researches are not being conducted. And this was a struggle for us. So to try to put this into their perspective, the actual policymakers who have to use research evidence, we can imagine how difficult it can be to come up with a decision-making process.
So I can speak to our experience where when we went to CARPHA, we were paired with one of the research scientists there, and we had the opportunity to help her on a variety of projects. And it was both what they needed to get out of the experience and what they needed the interns for, as well as what we wanted to get out of the experience. So like initially she gave us a list of a few things that necessarily had to be done, but then also we got to propose 4 or 5 activities that we wanted to learn about, such as like the mosquito testing. That was a little bit off a tangent off what they wanted initially, but we negotiated a work plan, and it worked out really well. We also got to work with a large team of people. So for each project, for instance, there were different experts at CARPHA that we needed to consult with, as well as different people from around the Caribbean that would be flying in or coming to the consultations who we meet with. So it's really a collaborative endeavor there, but we did have that one go-to person as well.
Do we have any other questions for anyone in the room about work that was done in CARPHA? So while people are thinking, I asked the health systems question last time, so I'll ask the cultural question. So just for each of you individually, what was something about living in Trinidad and Tobago that was either really interesting to you or surprised you or caught you off guard or something like that? So something unique about living in Trinidad and Tobago as opposed to living in Canada. So Stephen, I'll start with you.
Yeah, so personally, if I can be really honest, before going to this trip, I looked up on Google and just was researching about the country, and my prime, I guess, concern was safety. And on the internet, you read just like a lot of miscellaneous things, and people talked about how it's really dangerous and how it might not be the best idea to go. And so initially I was a little scared, I'm not going to lie, and so was Cameron, if you can confirm later. But when we actually went there and lived for 3 months, it's really exaggerated. There's nothing dangerous. We felt safe walking outside. It's really what you do in a country that's going to affect like your well-being and safety, not necessarily the place. So obviously, if you go out in the night in this like really weird neighborhood, you're going to feel that it may not be the safest place. But if you just conduct yourself in a normal manner where what you would do in, I don't know, Hamilton or Toronto, you're not going to be facing any safety issues. So I think that was a kind of an eye-opener for me. Just realized how gullible I was just reading these like internet articles and how quickly I fell into that trap. But if you go live there, it's totally safe.
Yeah, I have to agree with Stephen. We definitely were over scared for the experience. Now, in terms of what was the most memorable like cultural experience I had was I think it was like the first day or the first week or something like that. We were sitting in the hallway just like typing away on our laptops, and every single person that would walk by would be like, "Good morning," or "Good afternoon," or like "A good day." And even when you're on the streets, like everyone is just constantly like providing salutations to one another. And this was a real shock coming from like Toronto or Hamilton. When you're just walking down the street, no one's really, people that you don't know aren't really saying hi to you or acknowledging your presence. So we quickly learned how integral this was to their culture and how important it really was to acknowledge others, be respectful, be happy, smiling, and we soon adjusted to that as well.
Right, and if I can just add a bit more, the work setting, it was like a really big family. They really cared for you. They were always asking us, how's your stay? Can we do anything to help your stay better? So we always felt very welcomed, and just having someone there to always look out for us, it was really great.
Yeah, especially the human rights manager there. Her name was Binta, and she was almost like a second mother to us. Like the whole time, she guided us. She provided us advice. Times of need. So she was just amazing, and just goes to show you like the support system that they have there for the interns is amazing, for sure.
Great, thank you. Any other questions from anybody about? Okay, another one from someone in the room. Oh, we have another one. I'll go with that one first. So. All right, so here we go.
First off, thanks guys, that was great. I'm just wondering, as you're both pursuing careers in medicine, how your experience with QES will sort of inform your different paths and how you'll take this experience forward.
That's a very good question. I think, public health, working in a public health agency for the summer, well, personally, I didn't really know what public health agencies do, so I was very ignorant in that sense. By having the opportunity to work their first 3 months, I first of all learned what they do and how they are able to tackle different fields. So you can talk about diabetes, and then you can talk about like some non-communicable diseases, vector-borne diseases, so their spectrum is very wide. And that kind of approach is something that we've realized that here at the University of Toronto is something that we strive to do. They really strive to teach us the importance of public health as part of the curriculum. And in fact, there is I believe it's a club or some sort of organization within the faculty that encourages students to get involved in public health. So it definitely sparked my interest, and that's something that I want to potentially investigate in the future. So yeah.
On my end, I think I learned, well, as medical students here at Toronto, it's especially a very research-intensive institution. Students Stephen and I both really aspire to do research, and I think this experience really showed us about the steps that follow research production. So, it's not just creating research, but if you really want that research to have an impact, then you need to kind of think about the relationships that you have with policymakers and how you're going to actually disseminate this research and make sure that it results in some real-world changes. Because if you're not creating any change, then what's the point of innovating and developing new sorts of things?
Right, because when we're working at CARPHA, we actually had the chance to participate in a lot of the events hosted by the regional WHO there, also with the PAHO. So it was very international, and I think just building off of what Cameron said, you can gain an appreciation of how your research work can translate at an international level.
Thank you very much. I think we're at the point where we can probably draw things to a close. Thank you very much, Cameron and Stephen, for joining us remotely today from Toronto and delivering a very interesting presentation. I'll just skim through for a second the references that you have available, and when we do this online for the recording, I'll make sure that these are a little bit slower so that people can read them. And I'm leading us to this last slide, which is the thank you slide. And thank you for joining us today, to our presenters, to those who are here with me in the room, those who have joined us online. If you're interested in the Queen Elizabeth Scholarship Program, please visit that first link that's on the screen right now to give you it gives you information about how to apply. The second one is a list of all of the webinars that we'll be having throughout the term between now and December the 13th. And the third link is a link to our blog site where all of our forum scholars produce a blog about their experiences, a little bit more personal than what you would get in the webinar. So I encourage you to go and read those. And Cameron and Stephen's blogs will be available fairly soon, but between now and then, thank you very much, Cameron and Stephen. We appreciate you joining us today.
Thank you for having us. Our pleasure.
Great. Thank you, everyone, for joining us, and we'll see you again soon. Thank you.